One of the best ways to fight cancer is to catch it before it even starts. Preventing cancer starts with knowing where to look. Routine screenings are one of your best defenses to fight against this disease. Some cancers, when detected early, have a much higher chance of being treated with less invasive procedures and better outcomes. So in this video, we're revealing 5 preventative cancer screenings to get, so you can stay on top of your health. These tests are used for spotting cancer early and ensuring you have the best chance at successful treatment. Stick around to find out which screenings you should be getting to protect yourself and your future health. At number 5 on our list is skin cancer screening. Skin cancer is the most common cancer in the United States, with over 5 million cases treated each year. The good news is that skin cancer can often be spotted immediately. It's a cancer that is visible and can be detected through regular screenings even without going through a machine. There are 3 main types of skin cancer you should know about. Basal cell carcinoma, BCC, is the most common and least aggressive form. On the other hand, the second most common type is squamous cell carcinoma, SCC. Both BCC and SCC can be serious, but they're usually treatable when caught early. The third type, melanoma, is the deadliest form of skin cancer. It's known for its ability to spread quickly to other parts of the body if not detected and treated promptly. But how does a person get skin cancer? Several factors can increase your risk of developing skin cancer. Fair skin, a history of sunburns, and too much exposure to UV light from the sun or tanning beds are all significant risk factors. If you have a family history of skin cancer or have had it yourself in the past, you're also at higher risk. As for the presence of moles, people with many moles or unusual moles should be extra vigilant too. The American Academy of Dermatology strongly recommends regular skin checks, both by yourself and by a healthcare professional. So, what does a skin cancer screening look like? A visual skin exam involves a thorough inspection of your skin by a dermatologist. They'll look at every inch of your skin, from your scalp to the soles of your feet, searching for any unusual spots, moles, or changes. During the exam, your doctor will be on the lookout for the ABCDE signs of melanoma. These stand for asymmetry, border irregularity, color changes, diameter larger than 6 millimeters, and evolution, or changes over time. They'll also check for any new growths, sores that won't heal, or changes in existing moles. The benefits of these visual skin exams can help detect skin cancer in its earliest stages when it's most treatable. For melanoma, early detection can be the difference between life and death. But professional skin exams aren't the only line of defense. You play a crucial role in protecting your skin health too. Initially, you can do a self-exam for screening signs of skin cancer. When doing this, use a full-length mirror and a hand mirror to check all areas of your skin. Pay special attention to areas that get a lot of sun exposure, but don't forget about less obvious spots like between your toes or under your nails. Coming in at number 4 is colonoscopy. A colonoscopy is a procedure performed to screen for colorectal cancer. Colorectal cancer begins in the colon or rectum and is usually commonly screened in people under 50 years old. Experts advise that both men and women should start screening at age 45, 5 years earlier than previously recommended. Colonoscopy is the gold standard for colorectal cancer screening. The goal of this procedure is to find abnormal tissues in your colon called polyps. Polyps are small growths in the colon or rectum that can turn into cancer over time. Fortunately, it usually takes several years for a polyp to develop into cancer. This is good news because slow progression allows early polyp removal. When detected early, it's going to be easy to find and remove polyps before they become dangerous. A study in gastroenterology found that this screening method can lower the risk of dying from colorectal cancer by up to 88%. But what exactly happens during a colonoscopy? The procedure itself usually takes about 30 to 60 minutes. Before the test, you'll need to clean out your colon completely. This involves following a special diet and taking laxatives. While preparation for the procedure isn't fun, it's important for getting clear images of your colon. During the colonoscopy, you'll be given medication to help you relax. The doctor will then insert a long, flexible tube with a camera to examine the entire colon and rectum. And if the doctor finds any polyps during the procedure, they can remove them right then and there. After the colonoscopy, you'll need some time to recover from the sedation. You might feel a bit bloated or gassy, but these effects usually pass quickly. Most people can return to their normal activities the next day. It's important to note that while colonoscopy is highly effective, it's not the only screening option available. There are also other tests, like the fecal immunochemical test, FIT, which checks for hidden blood in the stool. The frequency of colonoscopy screenings depends on your risk factors. For people at average risk, it's typically recommended every 10 years. However, if you have a family history of colorectal cancer or other risk factors, you might need more frequent screenings. Sliding into number 3 is low-dose computed tomography. Low-dose computed tomography, or LDCT, is a screening test that can detect lung cancer. Screening for lung cancer is important as it usually doesn't cause symptoms until it's advanced. By the time someone starts coughing or feeling short of breath, the cancer might have already spread. Lung cancer screening is recommended each year for adults aged 50 to 80, especially for heavy smokers. This means people who have smoked the equivalent of a pack a day for 30 years and currently smoke or have quit within the past 15 years. While anyone can get lung cancer, smokers are more susceptible to lung cancer. In fact, about 80% to 90% of lung cancer deaths are linked to smoking. But even if you've never smoked, it's important to know the signs of lung cancer and talk to your doctor if you have concerns. This scan uses special X-ray equipment to create detailed pictures of your lungs. The low-dose part of its name means it uses less radiation than a regular CT scan. A large study found that among high-risk people, LDCT scans cut lung cancer deaths by 20% compared to standard chest X-rays. The LDCT procedure is quick and painless. You'll lie on a table that slides through a machine that looks like a large donut. Then the machine will take images of your lungs while you hold your breath for a few seconds at a time. The whole process usually takes less than 10 minutes. One of the big advantages of LDCT is its ability to find lung cancer early. When lung cancer is found at an early stage, the chances of survival are much better. For example, if lung cancer is diagnosed at stage 1, the 5-year survival rate is about 56%. But if it's not found until stage 4, that rate drops to just 5%. Of course, like any medical test, LDCT has some potential risks. There's a chance of false positive results, which can lead to unnecessary follow-up tests and anxiety. However, for high-risk individuals, the benefits of early detection generally outweigh these risks. It's important to remember that lung cancer screening is just a part of a comprehensive health plan. If you smoke, the single best thing you can do for your health is to quit. Now let's shift our focus from the lungs to a vital area of women's health. At number 2, we have cervical cancer screening. Cervical cancer starts in the cells of the cervix, the lower part of the uterus. It used to be one of the most common causes of cancer death for American women. However, the death rate has decreased over the past 40 years. This dramatic decrease is largely due to the widespread use of a powerful screening tool called the Pap test. This simple, painless procedure involves collecting cells from the cervix to check for abnormal changes that might lead to cancer. Additionally, in the 1980s, researchers discovered the link between HPV and cervical cancer. HPV tests can detect the presence of high-risk types of the virus before any cellular changes occur. The combination of Pap and HPV testing improves the chances of a successful treatment against cervical cancer. The FAP test alone can detect 70% to 90% of cervical cancers. When combined with HPV testing, the detection rate jumps to about 95%. So, when should you get screened? Women between the ages of 30 and 65 can choose to have a FAP test every 3 years, an HPV test every 5 years, or a combination of both tests every 5 years. Remember, cervical cancer often has no symptoms in its early stages. The cancer may have already progressed if you're experiencing abnormal bleeding or pain symptoms. Finally, at the top of our list at number 1 is mammogram. Mammograms are the most powerful tool to detect and fight against breast cancer. Studies found that people who get mammograms regularly have a 66% decreased risk of dying from breast cancer. A mammogram is an X-ray picture of the breast. During the exam, your breast is placed between 2 plastic plates. These plates flatten the breast tissue to get a clear image. The machine then takes X-ray pictures from different angles. It may be uncomfortable, but it only lasts for a few seconds. But what makes mammograms so effective is their ability to find breast cancer early. Additionally, mammograms can detect breast cancer up to 3 years even before you can feel a lump. This early detection is crucial because the earlier breast cancer is found, the easier it is to treat. Studies show that mammograms have a sensitivity of about 87%. This means they correctly identify breast cancer in 87% of women who have the disease. The American Cancer Society recommends that women after age 55 can switch to mammograms every other year. Mammograms are just one part of breast health. Knowing your breasts and what's normal for you is also important. If you notice any changes in your breasts, like a lump, skin changes, or nipple discharge, don't wait for your next mammogram. Talk to your doctor right away. And there you have it, the 5 preventative cancer screenings to get. Skin cancer screening, colonoscopy, low-dose computed tomography, cervical cancer screening, and mammogram. Regular cancer screenings are your best defense against a silent killer. These tests can catch cancer early when it's most treatable. By taking control of your health through regular screenings, you're not just detecting cancer early, you're potentially saving your own life. It's a simple step that can have a huge impact. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and hit the bell icon to stay updated with our latest health tips. Have you or anyone you know had any of these screenings done? If so, how was your experience and what advice would you give others? We'd love to hear your thoughts and stories in the comments below. And if this video has been valuable to you, please consider sending us a super thanks. Also, don't forget to check out our merchandise for some cool stuff. It's a wonderful way to support our channel and help us continue making informative content. Thank you for watching, and here's to your health.